Hello, everybody. Welcome to Remote Area Medical's Behind the Clinic. This is our webinar discussing students in healthcare. If you are unaware, Remote Area Medical is a nonprofit organization. We are led by the power of volunteers and individual donors to deliver free, quality care to those in need. Today, I'm joined by Dr. Kinzer and Dr. Davenport. As a reminder, if you have any questions throughout the entire meeting, please feel free to type them in the YouTube live stream chat. Dr. Eilene Kinzer is a native of Kent, Washington. She graduated from Metropolitan State College of Denver with a Bachelor's of Science in Biology. She received her Master's of Education in Visual Function and Learning and a Doctorate of Optometry from Pacific University. She completed a residency in Advanced Ocular Diseases at Indiana University School of Optometry. Dr. Kinzer is a fellow of the American Academy of Optometry and sits on various academy committees. After residency, Dr. Kinzer was a practicing optometrist in Grundy, Virginia, caring for patients in rural America. She's now an associate professor at the Kentucky College of Optometry in Pikeville, teaching clinical skills, pharmacology, ocular motility, glaucoma, low vision, interprofessional education, and pre- and post-operative care. She serves as the Director of Continuing Education for the college. Dr. Kinzer has a passion for providing eye care services in areas of need across the United States, including serving as a vision provider for remote area medical clinics in Seattle, Hazard, Elkhorn City, and also in other countries such as Honduras, Costa Rica, through the volunteer optometric services into community. Dr. Kinzer enjoys quilting, traveling with her husband, spending time with their dogs, and serving her community through local organizations, including the Lions Club. We are so grateful to have Dr. Eilene Kinzer here to speak about the importance of volunteering as a student and help give you guys some hints and tips and tricks about getting into school and things like that. So thank you, Dr. Kinzer, for joining us.
Thank you.
We also today have Dr. Lisa Davenport. Lisa Davenport, she's an RN and a CEN, and she is a clinical associate professor for the University of Tennessee College of Nursing. She serves as faculty in the RN to BSN online program at the University of Tennessee. She coordinates and teaches multiple courses using various teaching and learning strategies to promote evidence-based nursing practice. On behalf of the UT College of Nursing, she was awarded the role of Project Director, Principal Investigator for the federally funded Empowering and Transforming Public Health Nursing Education and Practice for Rural Underserved Areas to Improving Care using virtual-based simulation and experimental learning. It's also known as eThrive. In collaboration with Remote Area Medical, she led an interprofessional team of experts in community, public health, simulation, technology, and systems engineering to use innovative simulation-based modulities and experimental learning strategies to increase the capacity of RN to BSN students for public health nursing practice. Her clinical experience is emergency trauma nursing, and her scholarly work focuses on Appalachia, a region considered a rural and geographic health professionals shortage area where rural, impoverished, and underserved populations reside. Dr. Davenport's research interests include community-based participatory research working on nonprofit organizations, public health nursing practice, innovative teaching learning strategies to strengthen public health nursing competencies, recruitment and retention of public health nurses in rural Appalachia, and with the education to RN to BSN students. Thank you so much, Dr. Lisa Davenport, for joining us. We are so grateful to have you join us and have these conversations about why it's important to volunteer while you're getting your degree. Dr. Kinzer, if you'd like, I'm opening the floor for you to just kind of introduce yourself and explain who you are and how you got involved with RAM.
Yes, thank you so much, Alex. Gave a great introduction. Thanks for having me here. Just a little bit more about kind of my background on there. I became an optometrist because my optometrist literally helped me to see the world differently, right? Being able to go from a really blurry world to something really clear and sharp. And so I also learned from my optometrist about how eye doctors can also help with your person's health, right? So helping with diabetes, high blood pressure, helping with sports vision, helping kids grow and develop in their learning. And so that's one of the reasons what really drew me to RAM was that we were able to give that same benefit for people who may not otherwise have the opportunities financially to do that. And so it was really great that Remote Area Medical came to my private practice and reached out and said, do you want to be a part of this? And that was about 12 years ago. And so it's been really great to be working with the organization since then.
Yeah, definitely. And we are very, very grateful for you being here and for volunteering with us so frequently and being such a huge proponent and voice about volunteering with RAM. Dr. Davenport, would you like to introduce yourself and a little bit about how you became involved with RAM?
Sure. Thank you, Alex. I live in Upper East Tennessee, close to the Virginia and Tennessee state line border. I've been a registered nurse for 34 years. And throughout that time, I have enjoyed every facet of nursing that I've done. My clinical background is emergency trauma nursing, but many times I've worked two jobs at the same time. And part of that, I worked as a flight nurse for almost 10 years, along with working in the acute care setting in the ED. I entered UT. I'm a three-time graduate of UT. Entered as a first-generation college student in 1985. Graduated with my first nursing degree in 1990 and a master's in 2007. And once I achieved my master's, I went to teach at another university, and that's where I met Vicki Gregg. We taught alongside each other, and Vicki is the clinic manager for RAM. So I was very impressed as I watched her tirelessly advocate to incorporate students into RAM and to get their clinical experiences at RAM clinics. So I was very impressed. And then I received my PhD in 2013. And my chairperson of my dissertation committee asked me to serve as a project manager on a community-based grant, which I did. And that was the best yes I have ever made because it really opened my eyes to community public health nursing. And never did I realize, I'd treated 4 years patients that had asthma and chronic conditions, but never did I realize until I went into their homes what issues that community residents are encountering, and that's what was exacerbating their health conditions and impacting their inability to manage their health very well. So that opened my eyes to community health and meeting people where they are, and the importance of interprofessional collaborative practice because it takes all of us to address the issues and wrap our arms around it. And it takes multiple disciplines to work together. And so, yeah, here we are. And then just most recently, I received the eThrive grant. And we've been able to partner with RAM again to incorporate students, RN to BSN students, and then to partner with the telehealth offering that RAM has.
Thank you. And I know that the partnership for eThrive as well as telehealth has been absolutely amazing. And when I first heard about eThrive, I was like, that is such an amazing project. And I got to actually meet a couple of the people that came in and worked with them throughout the summer. I think last summer it was. It was really, really cool. So in talking about kind of the different routes that you can take while you're going through school, Dr. Davenport, what are some of the most important considerations when you're deciding on a profession or a school?
Well, first, I would say follow your goals and your dreams and your passions and find a school that aligns well with your interests. And then find a school that is accredited and the programs, and then seek. You can also seek non-traditional pathways to get to where you want to go. And so just follow those dreams and seek scholarships and seek a mentor that can help you complete those applications.
Yeah, definitely. Dr. Kinzer, do you have anything else to add to that?
Yeah, I think those are all great things that Dr. Davenport mentioned. Other things I tell my students or applicants when they're kind of considering which school to go to, what profession to go to, is, really look to see what you want to do and what you accomplish and find a school that matches that same mission that you have. So, at our college, part of our mission is to serve the underserved. And so that is where students really resonate. And that's one of the reasons why they attend our school, but also see what is a good fit, attend the campus tours, see what feels like, what's home, and also see what resources you have. Every student is different. Everyone learns a little differently, and other people need different resources. So what's the tutoring programs? What supplies do they offer you? What books do they offer you? What's the student affairs support that they can provide you?
Yeah, definitely. I definitely think all of those qualities are really important when searching and looking for where your right role is. So after a student has already decided this is where I want to go, this place fits and it is home for me. What are some of the more kind of like nuanced and finer details that are often you feel like missed or overlooked when they're applying, Dr. Kinzer?
When they're applying to the school?
Yes, ma'am.
Yeah, I think, as you're applying is definitely look at the overall application that you're having. And so, admissions wants to look, of course, at your grades and your entrance test that you have, but also what extracurriculars you have been part of, what service projects have you done, any research you've been involved in, what service projects have you done within your community? And then the other thing to consider when you're applying and really deciding your different schools, I will have to say is probably looking at also the cost of living in those areas that you have, and also what clinical opportunities you're going to get. Are you located in a rural school where you're going to be able to have access more to like remote area medical clinics? Are you more in the city, and do you have to travel to those, or are there opportunities to do that as well?
Yeah, definitely. Dr. Davenport, did you have anything else to add to that?
No, a lot of high schools have dual enrollment programs. So it's learning how to navigate that a little bit and what will count for college credit and making sure that does count and how you can incorporate that, but also look at service learning opportunities at the respective school because that will give you lots of opportunities. Like at UT, we have a program called Ignite that college freshmen can participate in, as a freshman when they first arrive. And my daughter was just a recent graduate of UT, and that's what a program that she was involved with, and she made relationships and connections that carry on today. And then another recommendation is to really secure your recommendation letters when you're applying, and support strong letters with that. And your essays, write very meaningful essays.
Yeah, and I think a lot of times that kind of interconnects, right? So like your essay, that service-based learning helps to promote that passion that is reflected in those essays.
Mm-hmm.
So based on your guys' experience, can you kind of talk about like the importance of volunteering while you're pursuing that degree? So like that service-based learning and the importance of volunteering and seeing that sort of need, if you will. Do you have any thoughts about that, Dr. Davenport?
I think it's essential. It will help you bridge theory to practice. It will help you, like I said, make connections with others and you begin to collaborate. We have a motto here at UT is one that beareth the torch, shadow oneself to others, to give light to others. And so you really, it becomes being a part of something larger than yourself. And it really helps with retention if you're become involved with volunteering, and it really helps you academically. You learn a lot of skills, soft skills such as therapeutic communication and active listening, and then you really learn empathy when you have conversations with those that you're serving, and you learn some of the situations that they're living in and circumstances. So, and you build self-efficacy and a spirit of utilitarian, the greatest for the greater good. So yeah.
Yeah, I definitely think all those things are really important about learning from volunteering. Dr. Kinzer, did you have anything to add about that?
Yeah, and I agree with everything, that you get from volunteering. When you're not quite yet in a professional school, even as a high school student or undergrad student, I think volunteering is important because then you also get to see the profession that you're contemplating pursuing and seeing that in action, and also helping those patients, even before you even get into that educational program. And then once you're in that professional program, you really get to apply what you're learning in class. In real time with your patients, and not having to wait until a few years down the road when your clinical curriculum is starting. I also always advise students, if when you have that hard test coming up, or you're struggling because the material's a little bit harder, seeing those patients helps you to recognize and say, this is why I'm overcoming these tough obstacles. This is why I have to persevere to get through it, is because at the end of the day, I get to do what I love, and that's serving people, that's helping people with their healthcare.
Yeah, that's amazing. And you guys are both such huge proponents about your students going and seeing that at RAM clinics. And we are very grateful for you guys being those voices and that kind of charge about bringing students in. So when you guys do bring your students in to volunteer at RAM clinics, do you see any sort of change in them following those experiences, Dr. Kinzer?
Yeah, I definitely see the change with our students. We encourage all of our students to participate in some sort of service project throughout each of their semesters. And sometimes students just come because they know a friend who said, hey, you should come to volunteer with us. But I always notice after even just the first few hours, students are like, why didn't I think about doing this even when I was an undergrad? And those are the students who also you'll see who are, when's the next clinic? When's the next RAM clinic? Can we do one next week? And they're always wanting to be able to help out more and more people, and they really recognize that a few hours of their time is really going to make an impact for someone's whole life.
Yeah, very much so. I know that there are a lot of stories about students coming in and being like, wow, that is so impactful. Dr. Davenport, did you see any changes in your students after they'd come and volunteered at clinic?
Yes, absolutely. RN to BSN students are already practicing professionals. They're RNs going to get their bachelor's degree as a stepping stone in their career, and they are engaged and they're experienced clinically. But once they see beyond the walls of an acute care facility, they are enlightened and their perspective shifts. And so we have been analyzing their reflective debriefs, and that's overwhelmingly the experiences have been positive but meaningful. We have one student this past winter referred a patient to the clinic, and that was one of the first patients that he triaged when he was doing clinicals there. And so that was very impactful. And so we've had students say that it's life-changing and it's made an impact on them.
Yeah, definitely. So because it is such a huge impact on those students, do you think, Dr. Davenport, do you think it should be a requirement for professional students to volunteer with organizations before graduation? And do you think it would affect their career moving forward?
At this point, we've had it optional for the students. And I think if you leave it optional, then the students are going to, if they choose RAM, then they're more engaged. But I would love to see it a requirement because it's important to see. And my students are online, so I can't require them technically. But I would love, further down the road, if we could have students required to do a clinic, and that way they can get the engagement that they need to enrich their education.
Yeah, definitely. Dr. Kinzer?
Yeah, I agree. We have it as an optional opportunity for the students to participate in remote area medical or any type of service clinic that they want to participate in. But sometimes adding that requirement helps because you're helping the student who maybe is not quite sure about what they're going to expect in this clinic. And if you have a requirement, then they're all in that same boat with everybody else that's there, and so they can kind of grow and learn together. And they take away so much, not just here are my clinical skills that I'm improving and being able to put into action, but also how to interact better with other people, because that is something that as a healthcare provider, every encounter you have is different, and just the more encounters you have with different people, the better you can be with your empathy and also just serving them.
Yeah, definitely. So how do you think that volunteering with RAM helps students grow into leaders, like within their community and also within the profession, Dr. Kinzer?
Yeah, so how I do it at our college is that I have a set of students who are student leads for each of the clinics. So these are students who have been at a RAM clinic before, and they're very excited, enthusiastic about recruiting other students to participate. And so I have them as team leads, and so they learn about how to organize the staffing for the clinic. How do you run the clinic? How do you get the clinic to flow? How do you work with the RAM volunteers and the staff that are there? And my goal from that is that they are super excited and they have those leadership tools and the ability to know how to run a clinic, that when they graduate they can go back to their hometowns and be able to participate in an established clinic or you know fundraise for their own clinic back in their hometown. And so that's something that I'm really proud of. Our students, every one of them have been student leads, have continued to volunteer with RAM even after graduation.
Yeah, that's amazing. Dr. Davenport?
Yes, I concur with Dr. Kinzer. It really inspires civic engagement. And it's very rewarding for me as a faculty person to go to a clinic and see a student that I had prior in a previous RAM clinic, but they've come to this RAM clinic on their own will. And so that's very rewarding for me. And that's what we want to inspire the next generation and leave that legacy for them.
Yeah, definitely. Do you think, or do you see any like major differences between viewing patients in a normal clinic as opposed to like a RAM clinic setting, Dr. Davenport?
Oh, absolutely. In an acute care setting, you have everything at your fingertips that you need. When you're at a RAM clinic, you're in a alternate environment, whether that's a school, a church, a parking lot, and then you may not have the resources there at your fingertips, and you learn to be resourceful, and you learn how to do education and nursing care in those alternate care settings.
Definitely. Dr. Kinzer?
Yeah, I agree. The setting is different. You don't get all the great technology and all the equipment that you have for an ideal situation. But also in a RAM clinic, you might be the only provider that that patient might see for the next year or two. And so it's really at a time where you can make such a great impact in such a short amount of time, and really addressing all of their concerns and helping provide them with additional resources that the clinic can offer for them. And how do you set them up with this visit is going to help them today, but also help them for the next year, versus, in a normal traditional clinic setting, you can always do follow-up exams and, follow up next month or follow up, in a couple months or a couple weeks. You don't quite always get that in a remote area medical clinic, but being able to address as many things as possible for that person really can be life-changing for them.
Yeah, definitely. So very frequently we have a lot of our volunteer coordinators that are having kind of go around this misconception that individuals have to be pursuing a medical or a dental or a vision profession in order to be able to volunteer at RAM. So what kind of difference do you think other students can make at a RAM clinic, Dr. Kinzer?
Yeah, I think that even if you are not interested in the health field, uh, you should still volunteer at RAM. There are so many other options you can do in volunteering. Sometimes it's just in the parking lots, handing out sandwiches, working in the cafeteria. These are people that you're gonna be working with, these patients who might have driven 8 hours the night before, slept in their cars, and now they're waking up at 4 o'clock in the morning to be able to see you. And so having that also just interaction with those people, even if you're maybe interested in social work or you're interested in teaching, it's just how do you handle different situations and how do you help people who maybe are having lack of sleep, right? And how do you have that empathy and build on that? And that's something you can apply to any profession.
Yeah, so it's kind of like those soft skills learned. And Dr. Davenport, did you have anything else to add about that?
No, I see a lot of disciplines that could be involved, and telehealth has really opened my eyes to that, and podiatry, you know, and other disciplines such as nutrition and social work, like Dr. Kinzer said, and even pharmacy students. We see patients there at the clinic that have been without medications for months. So it would be very impactful for pharmaceutical students to really experience that, and foreign language students, because I see a great need for interpreters. And so to give them that experiential learning would be valuable as well.
Yeah, definitely. One of our lowest recruitment is in interpreters, and we've kind of taken to going the Google Translate route, and it's not always quite as like involved as having an actual person there who makes the patient feel heard, if you will. And I also know that at a lot of our clinics, we have like nutritionists who come and like set up booths, and like I learn things from them. Like they'll show you how much sugar is in like a Coke bottle, and even I'm like, oh my gosh, that's so much sugar. Tell yourself anything if you were going back to school. What is one piece of advice or one thing that you would tell yourself if you could go back through school, Dr. Davenport?
I would have become involved much earlier than what I did. Like I said, I was a first generation college student, so I didn't have a lot of guidance. I didn't have a lot of opportunities, but I would have, certainly have become more involved with service, seek those opportunities, be involved and stay involved.
Yeah, Dr. Kinzer?
Yeah, I think I would tell my, postgraduate or pregraduate self is, enjoy the moment, enjoy every opportunity that you're being offered, right? Sometimes I think when you're in school, you're like, let me just get to graduation, let's just finish this test so I can get to the next test so I can graduate. But really enjoy the moment. You're learning so much in school, and there's so many opportunities that you can be a part of that will really help you build that foundation of the type of career person that you're going to be, if that's a clinician or any other type of profession that you have. And just like Dr. Davenport mentioned, is take all those opportunities that you can take, volunteer as much as you can, try to participate in those extracurriculars. You never know what's really going to spark your interest, and going to a meeting is not, maybe waste 2 minutes of time or 2 hours of your time if you find that you're not passionate about it, but it could also change, your career path.
Yeah, definitely. We do actually have a question here. So someone wants to know what your most impactful memory of a student at a clinic is. So like a student's experience at a clinic, Dr. Kinzer.
Yeah, I have so many. I will say it probably is, I don't have an exact one because it happens more often just because I've worked so many different clinics. We'll say it's the part where it clicks, where they realize, yes, I just took this test yesterday, but this is the actual application of it, and this is how that one skill that I've worked really hard on to learn is what's going to make a difference in this person's life. So they've diagnosed, unfortunately with patients, they come to RAM and they have different conditions that go undiagnosed, and so they are the person that is identifying this eye disease and identifying it earlier for that person. And so they're able to say, here's how we can help you. Here's who we can send you to. Here's how we can treat you. And here's how we can really help save your vision or save your quality of life in the future.
Yeah. Dr. Davenport, do you have a one specific memory about a student at a clinic that really made an impact on you?
Probably the one I just mentioned a few moments ago. That nurse had treated a patient in the ED who was having dental issues. And knowing that he was going to do his clinicals the next week, he referred that patient to the clinic. And that was the first patient that he triaged. And that was very meaningful to the student, just knowing that he had a small part in helping connect him to care. And so he was able to see him after he received the dental care that he needed. And it was meaningful to the patient as well.
Yeah, that is really meaningful. That's absolutely beautiful. And Dr. Davenport, in talking about like your experience volunteering with the telehealth unit and things like that, is how can that telehealth experience change with students' outlooks on like technology and things like that? Because a lot of times students don't really grasp the whole entire understanding of what telehealth is. I know I didn't until I experienced it firsthand. So how do you think that volunteering and experience that telehealth one-on-one and actually providing those services helps to change that outlook for your students?
So I think there's an assumption that telehealth is just a provider on one end and the patient on the other end. But what RAM has developed is a site-based model of care where there is a nurse there that's helping to bridge that communication. And, we've seen it, I've seen it over and over. But one meaningful experience that I had, and that's why I suggested podiatry, was that, I had a patient and the provider was, assessing him and talking with him. And he asked me to take his shoes off and his socks off. And I did. And that person, his great toe on the right foot and left foot was black. And so I knew that that patient was most likely going to lose those toes, but he was homeless. And so just knowing that the difficulties that that patient may experience in the future was very impactful for me, and that we need to do more. And that, it's an underserved population, and telehealth is doing remarkable things.
Yeah, definitely. Yeah, I know the first time I experienced walking into that mobile unit and I got to see like all the cool like cameras and things and how they can just learn so much about the patient with such
Mhm.
little equipment and in the middle of nowhere. It was really, really life-changing for me.
Yeah.
Dr. Kinzer, what is the importance of having the exposure for your students at multiple levels of their education? So, like the first years can do some things at the clinics, but second years can kind of have different experiences than the third years. What is the difference, or what's kind of like the importance of having that exposure at different levels? Like, what can they do at different levels throughout their experience in education?
Yeah, so the way that we run the vision section of our RAM clinics is that we have different stations. And so each station actually corresponds with the different years that the students are at. And so that student is learning those skills. They're, practicing it on their classmates. They're maybe having a few clinical encounters, but at the RAM clinic, they're now seeing 300 patients in a weekend where they're applying directly on that skill, and then they can go, the next year they come, now they're applying a different set of skills. And so the way that we have it is so that those students can develop, improve those skills, have more patient encounters, and really be able to impact more people's lives.
Yeah, definitely. And I know a lot of times it kind of can feel overwhelming to be one person trying to make a difference in the healthcare field when it's this kind of overarching and systemic problem. And it's like, well, what can one person do? So, Dr. Kinzer, if you could tell what what impact does one individual make when they're volunteering at a healthcare like in facility and things like that?
Yeah, and you're right, Alex. You sometimes think, "Oh, I'm just the one person. I'm definitely not going to make a difference." But you are making a difference. You're making a difference to that one person that you're able to help out. And even if we don't have, a full clinic, maybe you don't get, 30 providers being able to see 300 patients. Even if you're just the one provider seeing 10 patients, you're still making a positive impact for those 10 people. And those 10 people are going to now be able to make a positive impact to the other people that they encounter in their lives.
Yeah, definitely. Dr. Davenport?
And so I have a quote that I like. It's by Leroy Hood. It says, "Never underestimate the power of your vision to change the world." And whether that world is your community, your classroom, your office or church, wherever your world is, uh, don't underestimate your power and how your core beliefs and values can fundamentally change the paradigm of how we view problems and how we work collectively to address them.
Definitely. I love that quote. I've never heard that before. I'm going to write that down.
Yeah.
And you talked a little bit about kind of like within the community. What does it mean to you to be able to use for your profession and use your skills because to give back to your community? Because you volunteer a lot in Knoxville, here in Knoxville. So being able to give back to your community, what does that mean and do for you?
Um, it's service above self. You know, you see the need and you work to address the need. I've been privileged to, have what I have, and I just want to give everything, to others. That is my skills, my talents, whatever, my time. You know, I want to give that to serve those who are in need and to really make sure that I'm connecting with the mission and, and the vision. and the philosophy of RAM.
That's beautiful. Dr. Kinzer, what does it mean to give back to your community?
Yeah, I've been very blessed to be able to have this profession that I have, and to be able to have the resources to be able to help other people, and that's in time, like Dr. Davenport mentioned, in the skill set that we have. And so for me, it's really nice to be able to see my neighbors. Sometimes they do have to come to these clinics, and be able to help them out, and then be able to be a referral system for them afterwards. So not only are we helping our patients at that time of that clinic, but if they're able to have transportation, we also provide care for them afterwards. And that might be a surgical procedure that we might have to send them to one of our specialty clinics, helping them with follow-up care for an eye disease that they have at one of our partner clinics. It's something where we can not just help them at that moment, but be able to help them in their future, and to be able to help my neighbor and say, hey, I'm here for you. It's not just for this one day, but it's here for as long as you need it.
Yeah, I know that we definitely wouldn't be able to do what we do without the ability to have that follow-up care for those individuals, and being able to actually be like, listen, this isn't just a one-time thing. We have people and resources here to back up and talk the talk, if you will. So Dr. Kinzer, you've talked a lot about like skills and being able to provide those to the community. So can you kind of lean on the importance of like interprofessional education at all?
Yeah, interprofessional education, I think, is so key, right? When you see patients, it's not just you and your one specialty that you're seeing them. It's that patient and everything about them. And so RAM is a great way for students to learn about interprofessional education. The students are able to, work with the other departments, that's dentistry, pharmacy, the medical clinic side as well, where sometimes they take that patient and they walk that patient through the whole entire clinic. Sometimes it's where they're working with another student and they're actually working together to help that patient out. And that translates also into interprofessional education, where the students can now see a patient and learn from the RAM experience and say, this patient is coming in with, let's say, a headache. What are the different resources we can provide as optometrists? What can we provide as a pharmacist? What can we provide as a medical provider, and as a primary care doc?
Yeah, definitely. Dr. Davenport, do you have anything to add about that?
I'm a true believer of interprofessional care, and it really enhances your learning experience. And I see that at RAM every time I go. Just to give you a RAM example, I volunteered in Pahrump, Nevada last year, and I'm not allowed to practice as a nurse under the licensure restrictions in Nevada. So I was able to shadow in dental. I was a runner in dental, and I had the best experience, and I learned so much. So we can all learn from and with and about each other. And each discipline brings a lot of expertise and skill to the table that when we come together, we can really come up with creative, innovative solutions to problems.
Yeah, I love that. And I know that we at RAM frequently run into the problem of licensure laws and concerns and things like that. So if you could have one piece of advice to give to students about advocating for like that sort of stuff, what would you say to them about the issues surrounding licensure laws and things like that, Dr. Davenport?
Well, as a nurse, we work under a compact agreement. I have a multi-state licensure, but there are 3 states that have not, agreed to be a part of that compact, and Nevada is one of them. So I have to be really attentive to that, and advocate, wherever avenue I can to, open up those abilities to practice. But I do have to be respectful of the restrictions that are out there.
Definitely. Dr. Kinzer?
Yeah, I think, we as a optometrist, we have to be licensed in every state, and there's other health professions that require that as well. And so, like Dr. Davenport mentioned, it's really knowing what the requirements are for that state. If there is a place that you want to volunteer in all the time, maybe just get a permanent license there. But a lot of states now have volunteer licenses where if you apply ahead of time, you can actually just get a temporary license for the day. But the biggest thing is that the states that don't allow that is talk to your legislators, talk to the people, that you're voting into office, and ask them to see if they can adjust some of the policies and some of the laws so that we can help more people in whatever state that you are choosing to volunteer in.
Definitely. Well, we are coming up towards the end of the hour. So I would like just to open up the floor, Dr. Kinzer, if there's anything kind of like last parting words that you'd like to say, or anything that you wish to embark on any students listening, or if there's just one piece of advice that you could really get across for them. Is there anything that you'd like to add?
Yeah, I would say that if you are thinking about the health field, or you're not thinking about the health field, but you really have a calling to serve, I think remote area medical is a great way to do that. You don't have to have any skill sets. There is on-the-job training at RAM. You just have to volunteer, show up, and there's so many wonderful people who are there who want to help you and want to help you help other people. And so if you have an opportunity to, have one weekend, or even if it's just one day, I would say, try to make a transportation to get there, and get there early, drink your coffee, and be ready to have a great experience.
Dr. Davenport, is there anything that you would like to say?
I concur with Dr. Kinzer. There's just-in-time training there at RAM, so you may be a little apprehensive, before you walk through those doors, but once you walk through them, the leadership and all the core volunteers will embrace you, and you will have a sense of belonging.
Definitely. And Dr. Davenport, what is one piece of advice you would specifically give to nursing students? What is like the most important piece of advice that would lead to their success?
At a RAM clinic, or
Just in general, just for nursing students in general.
embrace every opportunity that you can to learn.
Yeah. Dr. Kinzer, do you have one for optometry students?
I agree with Dr. Davenport. Yeah, embrace every opportunity, take advantage of every opportunity that comes your way. And that includes shadowing as many optometrists as you can, so you can really see the diversity of the profession.
Perfect. And we do have, it looks like, one last question coming in. Dr. Kinzer, from your experience with RAM, what do you believe are the most pressing healthcare needs facing underserved populations, and how can future healthcare professionals address those challenges?
Yeah, I think, the last couple of years, I think access to healthcare. And so, we're really helping people who are working, but they don't have the full insurance coverage to help them. And so, like Dr. Davenport mentioned earlier, sometimes you have patients who have these medical conditions but can't afford their medications. And so they can come to their follow-up appointments, but they can't afford their medication. So the one thing I'm seeing recently is better access to medications and a better affordability. And I think as far as how we can help with that, that's again goes to legislation and helping to advocate for your patients and advocate for better patient care.
Definitely. Dr. Davenport, how about from your experience?
There's a lot of social determinants impacting the ability of persons to manage their care, and there's a lot of chronic conditions that are prevalent, specifically in the Appalachia region, and that's diabetes and heart disease, and stroke is prevalent, and obesity is prevalent. And so whatever means that we can do, we've got to extend education to people in the community, but also shore up these social determinants of health. It's the ability to access care and afford the medication, but it's also the ability to have transportation to get to the medical appointments that you need to primary care. And I know RAM is not meant to be a primary care; it's an episodic clinic, but to be able to get the care that you need, we've got to really work to shore up the social determinants.
Definitely. Well, thank you so much, ladies. I am so, so grateful that you were able to sit down and have these conversations with us. I think these conversations are extremely important to continue, especially with the new and upcoming students that you guys lead and that you guys are absolute role models for. And I think your voices are absolutely important to propelling those students into becoming caring and empathizing and strong professionals. And I'm so grateful that you are willing to sit down with us and have conversations with us. Thank you so much, and I hope you all have a wonderful evening. Thank you so much to all of you who are watching. If you are interested in getting involved, please feel free to visit our website, www.ramusa.org. You can volunteer, you can donate, you can follow us on social media and give us a like or a share and help spread the word about who we are and what we do. Anything and everything is welcome in supporting RAM and helping bring care to those in need. And this is us signing off, and I hope you all have a wonderful evening.